talk about the SI joint. So the SI joint made up between the sacrum and the ilium, right? This is the half of your pelvis. It articulates in kind of like an S-shaped joint right here. It's a very strong bony connection. And there's strong ligaments on the front side and the back side of the joint. So the back side, the joint is a little bit more deep to the ilium. Most of the time when people think that they have SI joint pain, they point to a spot like right above this main joint of the SI. That's not the only place though that you can have pain if you have an issue at the SI joint. With that said, though that's the most common place people point, it's not the only place. You can also have pain in your abdomen, sort of just to the side of your belly button and a little lower. You can have pain in the front of your hip and groin, down the front of your thigh, inner thigh. You can also have pain in like what feels like your hip joint, or even sciatica type pain down the side of the leg, and even into the lower leg. So it can come even to the lower part of the shin and outside of the foot. SI joint is a big joint innervated by a lot of nerves. Those nerves are the obturator nerve, the lumbosacral trunk, which eventually gives rise to the common perineal nerve, most specifically, the spinal nerves of the sacral plexus, as well as the superior gluteal nerve and the nerve to the quadratus femoris. Understanding all those nerve connections, or just understanding those nerves, now it makes sense why you might find those types of referral patterns. Front of the belly is more of an iliohypogastric referral pattern. That's one of the nerves of the lumbar plexus. So it has a relationship with the obturator nerve, relationship with the lumbosacral trunk. Down in the hip, getting more hip type pain, it's more than likely the superior gluteal nerve and the quadratus femoris nerve. And then the pain down the leg, more sciatica or into the lower leg, that's going to be the common perineal part of that lumbosacral trunk. This means that there's a lot of places that we can treat to affect the SI joint as well. But also, interesting enough with the SI joint, because of all these relationships through the nerves, that means that dysfunction or hypomobility at the joint, which is a common driver of problems there, can be affected by other things. A lot of issues in the viscera, both in the abdomen, pelvis, and the thoracic spine. The central nervous system, because it connects to the sacrum, which is part of the SI joint, as well as the lower leg, specifically that fibular tib fib joint, anterior compartment, just ankle mobility in general. So there's a lot of things that can mimic or result in SI joint hypomobility, but that doesn't mean that's where you're going to direct treatment. Knowing where to direct treatment is going to make all the difference in figuring out how to help someone.